Yeah, so first of all, the dual mechanism of action may have something to do with the sort of tail end of the good results that we've seen in the previous cohorts, the CIS, with or without papillary disease. So the dual mechanism is that you're getting lysis of the cells and eliciting the immune response. This targets the RBE2F pathway alterations in the cells, which are seen in the bladder cancer. But it not only lyses the cells, but also has a transgene for GM-CSF, which elicits again an immune response that may be longer lasting than what we've seen in the cytotoxics. So I think we're going to see this concept more and more of getting an immune response that is long lasting. The maintenance is probably important, as we see with BCG. BCG is a form of immunotherapy, of course, and time and time again we've seen that maintenance therapy is important with these drugs. Of course, that's sort of part of all the drug regimens now, getting maintenance therapies out to 2, even 3 years. But no question, this is a novel mechanism of action, and certainly adds to our armamentarium of the treatment options we have available for these patients.